for hosting me here. Thank you very much for the opportunity to be presenting the Horizon ConfidAge project, which is funded by the EU. And more specifically, it's on prediction and monitoring and personalized recommendations for the prevention and relief of dementia-related diseases. We're not tackling it yet. We just started. So we're in month 11, right? We have very good ideas. I could give you a very brief status. We're just entering the implementation stages and we're starting to accumulate data coming next year. So there's a lot to look forward to. We're a huge consortium, which by itself brings an enormous challenge of coordination. Myself, my role in the project, I'm a work package 3 leader, which is the most technical of all the work packages. And I do have the pleasure of working with many of these companies. But as you can see, ETL is part of this consortium. I've had the opportunity to speak with you, Mark, with Luke, of course, Tino, Sarah. Everyone here has been very instrumental in the communication process. And we have in the consortium members that touch upon research centers, industry players and stakeholders, legal experts and network associations, as well as industry stakeholders such as UBTech, which I represent today. But I will take you to the problem itself. ConfidAge is an approach which brings in together 39 organizations from 12 different countries around the EU. It's meant to deliver personalized age-related disease prevention, promoting healthy aging and reducing healthcare disparities across Europe. In order to do that, it's meant to investigate, develop and evaluate a complex of challenges around aging, such as Alzheimer's disease, dementia, frailty, combining the clinical expertise and technological innovation of the present with community engagement as its pillar. So with that in mind, it hopes to bring a pan-European framework to the community, which will aid in prevention intervention strategies. If you can focus, there's one way of simply delivering this problem by an image which you can see on the right, taking the example of dementia, where you can. And there's been a lot of research. I'm sure a lot of you have received articles lately from many different projects focusing on dementia and Alzheimer's that, bringing the findings from all these projects. And obviously some are very, very obvious, such as smoking or alcohol use and the damage they do in the brain. But they tend to average the risk factors, such as the ones that you see here, according to the population. And that, of course, as you mentioned, previously brings bias. And so wouldn't it be the question of this consortium is to utilize this existing knowledge around the clinical knowledge and all the findings that we in the long term discover, to create personalized health trajectories, which will be intervening and hopefully improving quality of life of people around Europe. But the key is personalization and imagine this health trajectory and these risk factors being presented on a person-to-person basis. So we have a huge collection of university hospitals and hospitals around Europe, which we have grouped into 5 clusters. Some are interested in the causal risk factors and towards early diagnosis and the prevention of dementia itself. As you can imagine, the early detection of risk factors, risk stratification. So these are the normal outcomes for hospitals in Cluster A. Cluster B is interested in the association between the development and dementia with other health-related conditions. Cluster C is looking into an improved and personalized interventions that can delay and relieve dementia. Cluster D is looking at the neuromechanics and fails prevention, as well as Cluster E looking at the active aging in terms of through the digital innovation labs and living labs. The 2 latter ones as you can see, mostly refer to the neuromechanics and the overall physiology, whereas others tend to bring social behavior, neurology, psychology, and other factors into the equation. Cluster A and B more to the omics and general genetics and biomarkers that are important to distinguish between different risk groups. As you can probably see from the use cases and the coverage our clinicians have brought in, we're trying to give as best as we can a 360-degree angle around the problem. Each of these clusters, in some cases, brings their data and their retrospective data, which is crucial for the process of validation. But at the same time, we have clusters which are using ConfidAge through its platform, the wearables, to be more exact, and other devices that, in fact, including augmented reality and virtual reality applications that would not only assist them into improving their memory and cognitive skills, but at the same time measure and evaluate their progression through the process. In this process, as you will see later, we are also motivating patients to be more active and be more socially engaged. And this is all to be driven by AI algorithms in the background. So the primary goals of our consortium would be to provide a more holistic, the 360-degree approach, as I mentioned earlier, around digital care. Second is the community-based healthcare and care services that stems from off the social behavior and social interaction, preventive and integrated care models, the AI that we bring in through different components and different algorithms in place, evidence-based health policies. We use observational data. We use all that data into the process. And of course, we have to prove that these do follow certain of the policies we have in place. Empowering and improving the health of digital literacy. We have specific components that not only assist the elderly to onboard the system, but also assist them in maintaining this relationship with the system itself and educate them further on the risks and factors that they would need to be careful for throughout the process in order to maintain a better quality of life. And that in turn would demonstrate the cost effectiveness of such a system if we could at least prevent the onset or delay the onset of such neurodegenerative diseases. We can then perhaps reduce the cost that has on healthcare systems in Europe. So the vision is, as to summarize, right, to promote for the general public a better well-being and health literacy for the clinicians, case studies free from biases and secure and informed decisions, technologies that are ethical, transparent, and responsible for policymakers, hopefully at some point the cross-border, the Holy Grail, the cross-border harmonized regulations. So what are the main challenges? Getting to slowly to the core of the problem. The heterogeneous data sources that we have. It's and I will briefly go on that later on. We have a whole list of different data sources stemming, as I said before, from omics all the way to physical activity data, even from neuromechanical on the neuromechanical side. So the challenge here is to integrate this information. It's also about bringing a community-based healthcare and explain these results better to the community itself and to the people involved. This is more so evident in the on the educational parts of the platform that we're trying to deliver. And then the social innovation, which is to deliver these results more concretely to a larger audience. I'm rushing through this because I know I don't have a lot of time and I have a lot of things to say. So this is how it looks. I don't believe it's very clear for some reason. All right, so in the core, at the core, you have the healthcare platform itself, and it's meant to introduce the big data innovations that I just described, explainable, multimodal, blockchain. Arguably, this is another way of looking at the cloud, I imagine, right? Using blockchain. Patient digital twin, this is one of the most, let's say, innovative aspects of AI that we bring, and scalable data storage. Now, these particular AI innovations are to be integrated together with advanced assistive applications from the robotic side, living labs, smart homes, and many more that we have in mind. In fact, incredible ideas there, as well as introducing all the medical innovations from the field, in order to capture and acquire these data sources more accurately, as well as introducing the ecosystem for stakeholders, which is primarily constitutes by primarily the social carers, of course, and the caregivers, patients, etc. So moving on to the innovations, the multimodal analysis. We know from the past, and I know this personally from experience, having done a lot of research on unimodal analysis on different industry sectors, but particularly from the security, that unimodal analysis using neural networks, for example, or other algorithms, foundational models, has worked very well. But in the recent years, Gen AI is one of the buzzwords in AI, in machine learning, but another much less known is multimodal analysis, and that is to bring in more information. For example, what if I could bring an MRI scan together with the progression of a disease that is being monitored by observational data from different biomarkers and different elements of the life, the quality of life, exercise, drinking habits, etc., together. What if I could correlate the two? And what if I could apply the latest forecasting models to see the progression of a disease in such a regard? The second challenge is to use digital twins. The digital twin, and I'll dedicate a very short slide very quickly. Imagine it as a simulation of your version, of the version that you could have in healthcare, and then having doctors play around with you in such a digital environment. And we can then, as you can imagine, play with all kinds of different medications and different strategies to improve their life, and even then validate what the effect that has by interventional studies. So it's bringing the two worlds together. Then we have elements in ConfidAge which deal with the educational part and how we can translate the findings that AI brings and the digital twins bring, not only to clinicians, which is the obvious one, but also to patients, and have them more engaged and more intrigued to work with us. Living labs is such a challenge. I will not spend too much time on this. I'm rushing through this. Multimodal systems, therefore. Why is it preferable now rather than, you may be wondering, well, I mean, we've experimented with neural networks since the 80s and neocongruent and other fascinating ideas. And multi-layer perceptron has been around since the 90s. Why now? Well, now is the time that we can bring recent advancements from machine learning, data science, and cross-disciplinary approaches. It isn't just about the progression by looking at MRI, but we can also bring large language models together with all of these different dimensions, with all these different modalities, and have them as well interpreting complex relationships between all these dimensions. So in the past, where we had databases of fragmented data and limited AI ML scope with all these cross-border challenges and the reactive healthcare, today can be seen as a data integration project with advanced machine learning algorithms and provision and personalization, in order to deliver at some point cross-border integration, even more secure machine learning and explainable algorithms and patient-centric healthcare for all. Lastly, the digital twin. Imagine this as a replica of a patient, which enables real-time simulation and personalized care by integrating data from multiple sources. The digital version of you, the digital copies of you, almost like a Gen I, but with so many different copies of you of different studies that can relate your genome, all the different sources that all the different data that we've collected from you to create different drug diseases, new drugs, new medication, new prevention therapies, or perhaps boost social behavior. So we're pushing the simulations, we're pushing virtual health to its limits in order to provide the optimum health trajectory path through personal care. So this is meant to be more proactive. This is meant to empower clinicians with all the experiments they would like to do to patients, and they couldn't, not just because of time, but also resource limitations, et cetera, but then also the ability to simulate through populations and perhaps examine the biases problem more closely, right? What works in one population doesn't necessarily mean that it will work to another, but then this is why you would have such a laboratory to play with. Very quickly, we're doing this not just but reinventing the wheel. Yeah, I know. Just what 30 seconds. 30 seconds. Not by reinventing the wheel, right? We're building upon a consortium which has the frameworks in place, which has the proven interoperability standards we mentioned, FHR, the consortium expertise, the digital innovation hubs, and the development of scalable solutions. And lastly, a huge network of consortium members that covers different aspects in healthcare.